Sema bwana. Imeanza.
Check 1 2, sound check 1 2. 1 2 1 2, check 1 2. Check 1 2, sound check 1 2.
Today, I'm delighted to inform you that we have discharged a record of 97 patients from various hospitals countrywide. This now raises our tally of recoveries to 849. This is the highest number of recoveries that we have recorded in a 24-hour period. As the infections rise, we are at the same time recording a high number of recoveries. This is commendable and is proof that contracting the virus is not a death sentence. I therefore want to thank our healthcare workers for this achievement. The rising number of positives also point to containment measures not being fully observed. We have recorded 95 positive cases out of 1,096 samples that we tested in the past 24 hours. The total number of cases in the country to date is 2,862, and the overall samples tested so far is 98,439. Out of the positive cases, 92 are Kenyans, while 3 are foreign nationals. These 95 cases are distributed in the counties as follows: Mombasa, 56 cases; Nairobi, 13 cases; Busia, 10 cases; Kajiado, 6 cases; Kilifi, 3 cases; Kitui, Kwale, Garissa, and Marsabit each have 1 case. Note that Marsabit becomes the latest county to join that rank of counties that have reported a positive case, bringing the total number of the 47 counties in our country that now have recorded a positive case to 38. The cases are distributed in the following sub-counties. We begin with Mombasa with the highest, 56 cases. We find that 22 are from Vita, 13 from Changamwe, 7 from Nyali, 6 from Kisauni, 5 from Likoni, and 3 from Jomvu. In Nairobi, the 13 cases are from Kibra, 10, Langata, Kasarani, Dagoretti North each have 1 case. In Busia, 9 of the 10 recorded cases are of truck drivers from Malaba border point, while Busia border point has 1 case. In Kajiado, the 6 cases are from Kajiado town. The 6 cases are from Kajiado town, 3, Kajiado East 2, and Kajiado North 1. In Nyeri, all 3 cases are of healthcare workers from Nyeri Central. In Kilifi, the 3 cases are from Kilifi North, while Kitui has 1 case from Kitui Central, Kwale 1 case from Sambweni, Garissa 1 case from Dada, and Marsabit 1 case from North Hall. In terms of gender, 57 of these 95 are males, and the remaining 38 are females. The youngest is a 1-year-old child, while the oldest is 72 years old. Again, sadly, we have lost one more patient from Nairobi to COVID-19 disease, bringing the total fatality number to 85. We send our deepest condolences to the bereaved family. In conclusion, I want to commend our healthcare workers of all cadres who are doing a great job under very difficult circumstances. You will note that today we have mentioned that there are 3 healthcare workers who have tested positive in Nyeri. Again, this tells you that our healthcare workers who are in the front line are also at risk, and from time to time we will see some of these health workers turning positive.
But I can confirm to you that over the weekend, we've tried our best to clear this backlog, which mainly affected truck drivers. And most of these results have now been released to the respective recipients. This is not, of course, to say that we are still not facing issues with our supply chain management. We are trying very hard to sort out this, and I can indeed confirm that whatever backlog was there will be cleared and will be history. As we speak, I can confirm that we're in the process of clearing a nice consignment of test kits, or manual test kits. And in the coming 2 days, I guess you'll be receiving another hundreds of thousands of automatic test kits, which therefore means we should be able to utilize all our testing capacity using the automatic, or at least quite a good number of automatic and manual operating systems or platforms. So at the moment, the backlog is minimal and we are still fighting with it. We have empowered a lot of testing capacity in the western region, where most of the truck drivers are stuck. And as CAS Rashid has pointed out, you may be here reading from the media and TVs. And watching on TV, you are actually the owners of this. Well, the snarl up of traffic in Maraba and Busia. And as a ministry, and as actually not a Ministry of Health, there's a multi-agency force that is in Malaba and Busia trying to clear that backlog. That started from diplomatic discussions with Uganda. And later on, last week, but one, we launched a team of health workers to go and try and get as many samples from truck drivers who arrived at the border point without the requisite attestations to COVID-19 testing, or what you would call a certificate. So we have done lots of testing of these drivers. We'll cover the tune of 5,000 to 6,000 of them, and issued certificates, and we can confirm that the flow of traffic in Malaba has now eased out. We were on a two-lane traffic snarl-up, but as of today, we are actually on a single lane snarl-up. The jam has reduced from 74 kilometers to be just short of 34 kilometers, and it is still flowing.